Thank you, Alisa. So let's look at what happened during the Tokyo Olympic 2020. First, protests from the locals. More than 80% of Japanese people objected to the country continuing to host the Olympic, which was delayed due to COVID-19. It is based on the polls released less than 10 weeks from the date of the Tokyo Games. The survey comes after Japan extended a curfew as the country fought a fourth wave of infection. A survey by the Asahi Shimbun newspaper found that 43% wanted the Games to be cancelled and another 40% wanted it extended. For months, polls found majority of Japanese people objected to the sporting event continuing. Although vaccination programs are still underway, the population that has already received the vaccine is still insufficient to guarantee group immunity. The head of the Japanese Medical Association said there was a possibility a new mutation as the Olympic involved communities from 200 countries and regions. However, the Olympics are still underway because Deputy President of the International Olympic Committee IOC, John Coates, said that the Games are bigger than the virus that is spreading. He also said that the Olympic will not be cancelled unless World War breaks out. And he asserted that the Games will continue with the organizer to reschedule the dates. In addition, one of the first teams to arrive in Japan for the Games provided a worrying example. On June 19, the Ugandan coach tested positive when he arrived at the Tokyo airport, despite having 2 negative tests before his flight. Another member of the team tested positive later, leading the quarantine of the entire team, but not before the athlete met with local officials in the town where they were staying. Fortunately, no local infection have been reported from the encounter. Lastly, Hitoshi Oshitani, the virologist who helped devise Japan's COVID-19 strategy, has concern about hosting thousands of overseas visitors at a time when many countries are battling new surge of the virus. For example, Indonesia is facing its worst outbreak since the pandemic began, recording more than 30,000 new cases per day. But his biggest concern is that the Olympic will transmit the virus across Japan as volunteers and staff travel to and from Tokyo to pull off the event. It is because several events will be held outside of Tokyo, like the marathon race and soccer games, which will take place on the island of Hokkaido. As a precaution, the authorities had taken many steps to avoid COVID-19 cluster in the Olympic. For example, Olympic organizers have created a playbook of guidelines for those traveling to Japan for the Games, relying on frequent testing, masking wearing, social distancing measures, and requirement to stick to isolation bubble as much as possible. Next, the guarantee from IOC President Thomas Bach. Thomas has assured athletes that they should travel to Tokyo with full confidence and has the mindset that the Games will be safe for them and they will not jeopardize the health of the Japanese people. In addition to comprehensive COVID-19 testing, athletes, staff, and authorities may only be in their official hotel, vehicles, venue, and cannot venture out into the city. Thus, there will be no mixing of athletes, staff, and other authorities with the general population of Japan. Unfortunately, even though there are many steps taken by the authorities, no one can stop COVID-19 from spreading. Tokyo Metropolitan Government announced a record number of 4,058 infections in the past 24 hours, topping 4,000 for the first time. Olympic organizer reported 21 new COVID-19 cases related to the Games, bringing the total to 241 since the 1st of July. The record comes a day after Japan extended its state of emergency for Tokyo to the end of August. Next, Hospital Director Dr. Hironori Sagara said in Showa University Hospital, the highly infectious Delta variant accounts for 70% of all cases of COVID-19. Young patients are filling up the wards, and Sagara said the Olympics are partly to blame. Lastly, one nurse said his patients are going through a painful time. The reality is the number of patients is increasing while the vaccine rollout is not increasing in Japan. In conclusion, the things that happened during the Tokyo Olympic 2020 left a big impact for many countries, especially Japan.